Hello everyone, this is Mubarak Ali Khan and a special hello to the nurses. This particular video is for my nurses basically, and it's about OET. If you are appearing in your OET exam and you wish to go abroad, for example, for some reasons, so this particular video will help you to introduce yourself into speaking part. In the speaking part, you have total 20 minutes and there are 2 role plays you have to perform with an interlocutor for sure. So the first thing which you have to think and which you have to for sure show, and that is your introduction. So today we are talking about that. One more thing about the OET speaking exam is that if you're a nurse or a dentist or maybe a veterinary doctor, or you're a doctor or someone, let's say from medicine, or you're a pharmacist, you will become the one who you are already. Okay, it is basically subject based. For example, if it is the case that you are a nurse, so you will stay a nurse. It won't be that you become caretaker or you become patient, and likewise you stay doctor, you will stay doctor and something. So don't worry about it that you'll become patient, or maybe they give you the task which is not basically suits your profession. It won't be the case at all. So let's get clear about it over here for now. Moving on to the topic today, and today we are learning how to introduce ourselves. I'll be giving you different settings and we'll make sure that you introduce yourself slightly different in different situations. But initially I'm giving you the standard introduction of yours so that you could do the needful, or you could amend it or blend it depending upon the time slot or depending upon the setting you have, because there are different settings. All right then, the first and the foremost thing in introduction is basically the greetings. Then you should say your name. Then you should tell that you are a registered nurse, because it's for nurses only and the others will do accordingly. And then most importantly, you will be having a question in that about the health, maybe if he is a new patient, so you will be talking about that too, or something like that. So how would we do it? Let's try it. Good morning, my name is Sarah and I am a nurse, a registered nurse, and I can help you in terms of telling you the schedules of the doctor, or how else can I help you? It can be one way, a general one, or a second one could happen. Greetings. Thank you for visiting here. My name is Sarah and I am a registered nurse. How can I help you? It can also be helpful. Now let me give you different settings and let's see that how in different settings you will introduce yourself. For example, it's a home visit and you're visiting someone's home. So additional to the regular intro you had, you will add something into that. For example, good evening, my name is Sarah and I am being sent from Dr. AJ, and can you please let me know how can I help? And please add into that, would you mind telling me that this is the right time to talk to you, or is this the right time to talk to you? Or inquire about the person. For example, I'm here to see Mr. Johns. If he is here, please ask him to see me. Or if Johns is there already, or maybe let's say Miss Anam is there already, so say, Miss Anam, I hope you won't mind if I talk about some regular checkup with you, if you don't mind that. So it is the good thing that you inquire the basics, you do the courtesy in your introduction, and you try to show that you have something so important to say over that. Let's change the scenario now. For example, it's about general ward, and you know the patient already, so this time you may not ask about the name. For example, you say, hi, my name is Sarah and I am here for the follow-up. You just rang the bell, can I help you? It can be one thing, or you could replace it some other way. The good one would be, for example, if the patient is in pain and he has just left his ward and he is in the corridor now where you are the shift in charge. So it would be, so sad to see you here in front. Are you okay, or are you feeling pain? May I get to know where is it hurting, or have you taken your dose or not? So it will be a regular, a kind of instantaneous start. You won't be going for the formalities. But make sure that if it's a regular meetup, for example, there are 10 different categories in which these are 10 different categories in which you may be exposed to on the day of the test. Okay, so what are these 10? Let me read it for you and please note it down so that you could prepare your introduction accordingly. The first one, it can be clinic or community health office. It can be hospital ward. It can be home visit, as I mentioned already. It can be emergency department and maybe it's not urgent. It can be emergency department in which there is emergency. Okay, by the way, if it is emergency department and there is emergency, so regularly what do we say is, oh, I see that you're bleeding heavily. I could see that the blood is dripping down from your head. Would you mind telling me your name so that I could start my basic proceedings with you? And meanwhile, I'll be taking care of it with my alcoholic swabs or whatsoever you call it. So it is somehow slightly different than the regular one. Then the other thing could have been recovering room, like the person is getting recovered now. It can be a palliative care center. For example, there is someone who has some issue which is supposed to be prolonged. So over there, asking about, I hope you're feeling well, won't work. Because if you say, my name is Sarah, I hope you're feeling well, that person will be angry on you, that you know that I'm in pain throughout, constantly I'm like this, so how dare you saying this to me? Next situation can be school clinic, that you are in a school clinic and over there is some student. So over there, try adding one phrase into that. I hope that you do not have your regular classes after this, so that you get to know that if he has classes, so give some urgent remedies and let him go. Or if you think that he does not have the class or something, so it's okay to ask him or to tell the admin to put him on short leave or something. So this thing can also be taken care of. It can also be intensive care unit, and make sure that you do not ask about the name again and again, because it's there already onto the, for example, if the patient is in ICU, so he has signed the basic thing or something. So try inquiring it. So you tell that, okay, I know your name already. So how are you feeling now, Miss Anam? I'll be taking care of you for next couple of hours. So try giving him hope or giving her hope, then the formalities. Okay, moving on to another, it can be hospital setting I talked about. It can be ward corridor. So to cut a long story short, these are 10 different things you can be exposed to on the day of your interview. Okay, for example, the role play, such kind of setting you can be exposed to. So make sure that you act accordingly. And please prepare your introduction right now. If you have made a preparation onto the introduction, you will hit the first task very well. Okay, and you see, if you're not introducing yourself, no one knows who you are, and you start speaking randomly, it won't be a good thing. Make sure that you are fluent while you're introducing yourself, because it's about you. Well, it won't be a good idea that you don't know about yourself much. Okay, consider that how uncouth that would be. And if you don't introduce yourself and you start giving the insulins, for example, or giving some tablets, or maybe injecting some injections, it won't work. So start with introduction and then enjoy the regular conversation, and please enjoy the process. There's nothing much. Feel home in whichever setting you are. Try putting yourself into the setting, and don't be factful. Maybe there's time when you don't know about that setting, so it doesn't matter. Thank you very much for patient hearing. I'll see you around. Bye-bye.